At least 1 million Americans are living with a brain tumor today, and with more than 100 distinct types, each has its own unique set of treatments and outcomes. MUSC Hollings Cancer Center is one of the first in the entire country to get the latest version of what's called a gamma knife. Here to share more on this program is Dr. Charlotte Rivers, radiation oncologist at MUSC. Dr. Rivers, thank you for joining us today.
Thank you for having me.
So what is a gamma knife?
So a gamma knife is not a knife. It's a non-invasive radiation procedure that we use to deliver very high-dose focused radiation treatment for patients with brain tumors.
Okay, and now how does the gamma knife work?
So the gamma knife actually has 192 cobalt radiation sources in it that surround the patient's head. Each one gives off a very weak pinpoint beam of radiation that's pretty much harmless. And then all of those beams come together to make a very high dose. And so we essentially position the patient in the machine so that the tumor or whatever we're treating is right on the crosshairs of all of those beams.
And now with gamma knife, what does the eligibility look like? Anyone with a brain tumor is a candidate or no?
So it depends. There are two general types of brain tumors. There are patients who have cancer that spreads to the brain. That's what we call brain metastases, and most of those patients are candidates for gamma knife. And then patients with primary brain tumors, meaning that started in the brain or spine. And many of those patients are candidates depending on the diagnosis that they have and what other treatments they've had.
And now what are the benefits of using gamma knife versus other treatment options?
So gamma knife for radiation in the brain is really the gold standard for precision. It was invented back in the 1960s as a way to treat deep lesions in the brain without opening the head. And there are some other ways to do it, but really it's the only machine that allows a sub-millimeter accuracy in treating lesions in the brain.
So it really helps lessen the possibility of other things that could happen during brain surgery or other damage to the brain?
Yeah, exactly.
Okay. And now, how long has Hollings Cancer Center had the gamma knife?
We've had the gamma knife for about 13 years, and we've treated about 3,500 patients in that time.
And now the gamma knife is not something you find at every treatment center,
yes,
right?
We're the only center in the state that has a gamma knife currently.
And now, have you guys made any advancements to the gamma knife? Has there been any recent advancements?
Yeah, so we were actually, I believe, the 4th in the country to get the newest version of the gamma knife. It's called the Gamma Knife Esprit, and there are some upgrades to this particular machine. So it allows us to either treat the patient in a head frame, a surgical frame, which sort of keeps their head very still, or we can treat the patients with a less invasive mask fixation. There's some onboard imaging, so there are just some features to help make the patients more comfortable.
Do you think that the gamma knife could ever evolve to a point where we're able to use it to treat other parts of the body that have cancer?
You know, the gamma knife is really designed just for the brain. There are other types of radiation and other machines that we use to deliver similar treatments to other parts of the body.
Okay. And now when we're talking about a brain tumor, what are the typical symptoms of someone that has a brain tumor?
They really are a range. You know, we see some patients that it can be anything from severe headaches or personality changes. It depends where in the brain the tumor is. So some people come in with a seizure. Sometimes it's weakness or numbness in part of the body. It really can be a range of symptoms that people have.
Is there a demographic that's more likely to be affected?
In general, it can be older patients, so patients in their 60s or above, and then also we have a fair amount of pediatric brain tumors as well. So it can really, there's a really large range of ages that it can affect.
And it seems like the symptoms can you can categorize those things into a multitude of different possibilities. What do you recommend for us to just keep up with our brain health and to make sure that everything is all good up there?
I mean, you know, they're very rare, thankfully. I think one of the biggest things you can do is just try and keep up with a primary care physician, make sure you're doing all your screening for other types of cancers, because often those cancers can spread to the brain. And then of course, if you have any symptoms, we want those to be checked out sooner rather than later. So having a good relationship with a primary care doctor is really important.
Now, Dr. Rivers, where can our audience go to find out more information on the gamma knife and also Hollings Cancer Center?
They can go to our website, the Hollings Cancer Center or MUSC website. You know, we see patients from all over the state. One of the things that COVID brought to us is the fact that we can do virtual visits. So if you or a family member have questions about a brain tumor, always happy to talk with you over the phone or over video as well.
Wonderful, Dr. Rivers. Well, thank you so much for coming in and talking about this really important topic.
Thank you for having me.
We're back after this.